Welcome them to session 172 today, which is the long-term effects of radioactive iodine and external beam radiation on oral health. Today we have with us as speakers Dr. Ruth Aponte-Wesson, if I'm pronouncing your name correctly, and Dr. Mark Chambers, both of whom are from the MD Anderson Cancer Center here at Houston, Texas. So we welcome them in person. We say thank you very much for coming. Can I call you Dr. Ruth? Would that be okay?
That will be just fine.
Thank you. Dr. Ruth is a professor in the section of oral oncology and maxillofacial prosthodontics of the Department of Head and Neck Surgery at the University of Texas MD Anderson Cancer Center, Houston, Texas. Dr. Aponte-Wesson, or Dr. Ruth as I'm calling her, is a member of a large multidisciplinary practice at MDACC. She works very closely with colleagues in head and neck surgery, radiation oncology, plastics, speech pathology, lymphoma, myeloma, leukemia, breast medical oncology, among other disciplines. Her focus has always been on improving quality of life of the patient after cancer treatment. Some of the areas explored are related to materials used in the rehabilitation of intra and extraoral defects, as well as reported outcome assessment, specifically oral morbidities related to cancer therapies. And then we also have Dr. Chambers. Dr. Chambers is a tenured professor and clinical investigator in the Department of Head and Neck Surgery, Division of Surgery, and the Department of Radiation Oncology, Division of Radiation Oncology at the University of Texas MD Anderson Cancer Center in Houston, Texas. He is the Susan and Christopher D'Amico Chair in Viral Associated Malignancies. He also serves as Deputy Chair for the Department of Head and Neck Surgery and Chief of the Section of Oral Oncology. Dr. Chambers is recognized nationally and internationally as an oral oncologist and clinical investigator with a focus on developing novel therapeutic approaches to the oral sequelae of cancer therapy. Research interests include biomarker analyses and the oral microbiome influence on cancer development. Hence, research focuses to develop strategies in reducing cancer treatment-related oral morbidity and protocols to prevent or reduce such complications. Dr. Chambers serves as a ThyCa medical advisor also. So we welcome both of you today to our session. Again, the title of the session is long-term effects of radioactive iodine and external beam radiation on oral health. And without further ado, I'll hand it over to our speakers. Thank you.
Thank you very much, Timothy. Dr. Aponte and I are very grateful for your lovely introduction. And really, as an introduction to this actual session, our goal setting today of Dr. Aponte and I are really to talk about long-term impact of the manifestations of radiation and radioactive iodine to the mouth and to the upper aerodigestive tract, and some ideas that we have with regards to some prevention opportunities. So management and prevention is what we have spent a great deal of our efforts in at MD Anderson for cancer in general, and then for each of our site-specific medical centers. So this is kind of a meet the professor type of environment that we ask you to give us whatever kind of question you have, or wanting our opinion, or you would like to see how you get into MD Anderson for an assessment for oral manifestations. We're here to do that. So really the goal setting today is what I started about 2 to 3 years ago, even having given lectures, presentations here really for 20 plus years, is having that exchange where we never seem to have enough time on Q&A. And I think that's where some of probably the greatest bits of take-home message really comes from. So Dr. Aponte and I had a presentation today that was to really outline in our first discussion the types of complications that develop from iodine 131 and also external beam radiation treatment, as well as surgical intervention to the oral cavity and the upper aerodigestive tract. And it can list, that list would really be one that is even growing today because of some new manifestations that we're actually seeing. So for many years, for patients that have any type of over 150 millicuries of iodine 131 therapy, we've had a very long database assessment on our patients coming into MD Anderson that it shows the diminishing impact, and particularly at the beginnings after 131 therapy, to see what actually happens when the salivary function starts to reduce and starts to diminish. And it can have a major impact on really the oral equilibrium of the beginnings of the upper aerodigestive tract. Everything that goes into that tract has to go through the portal, through the mouth. And when we get 131 therapy, and the higher you go on millicurie treatment, and again, if you add the external beam element, you can really see some profound challenges. We grade the actual oral morbidities, the side effects of these types of treatments, and the more the millicurie, the more the intervention, the more the damage. Typically, the higher the grade of an issue. So that could be xerostomia, which is a dry mouth. It could be taste acuity challenges. It could be oral bleeding. It can be gingivitis, periodontal disease, hypersensitivity to teeth. It can be malocclusion of the jaw. It can be where you get these accretions on the teeth. This is buildup, biofilms that develop on the teeth, and you feel like you just never can really brush well, and to get all that off. And then cavities that start to become problematic and sometimes difficult to control. And some of that's familial too, by the way, the number of us that tend to have a higher concentration of cavities. And the bottom line really is that there is a very strong need for our patients who are going through the workup of a thyroid cancer diagnosis to have an oral specialist also be part of that team in order to give an increase in the outcome as to supportive care and to measures that can enhance the mouth and the body thereafter. So that's an introduction to the type of side effects that we do see. And we are going to want to, as a springboard, start to now open up for Q&A.
Just the fact that when we evaluate the patient, for the first time, what we want to do basically is to try to eliminate any area of infection or potential infection, so they can carry through, with the treatment that is proposed. And so that's basically, the goal that we have. And so by doing so, we can prevent a lot of damage going down the road. And I think, that is very, very helpful for the patient.
So let's start off with a Q&A. Our goal today is meet the professor. And if you have any issues over the next 30 minutes or so, my dear, do you have any questions? Do you have anything that you would like to ask? Well, I think we'll have to do it this way, don't we?
So I had I was diagnosed with anaplastic in 2011,
Oh, wow.
and I had radioactive iodine to start with, and then 30 external beam radiation treatments. And my saliva is not great, and swallowing is terrible. But I can live with it, that's for sure. But I'm just afraid that the saliva problem will get even worse. Whenever I travel or wherever I go, I always have liquid, and I don't dare eat unless I have liquid.
Yes.
But as for, I don't have cracking. The teeth haven't fallen apart. My the oncologist, before I had my radiation, he told me to chew 4 or 5 sticks of gum and then put them on all the fillings so that it didn't bounce around. And I think that was a good thing.
Well, that's interesting.
Because it's 11 years. I think I've broken 2 teeth, but they were old fillings, so who knows what caused it.
Right.
But just ways to make sure that this saliva problem doesn't get worse or.
Exactly. And honestly, that is a testament to your ability to keep your mouth so clean. The majority of our patients who go through 131 and external beam radiation treatment do quite well. However, as we all age, we also on the dry mouth side of conditions, we start to see changes in the salivary gland anatomy. And then the glands actually get smaller. And as they get smaller, as we grow older, we tend to produce less saliva naturally. So now we add onto it all the other medications that we also all have to live and to survive, heart medicines, anxiolytics, patients that are on antidepressants, any of us taking medicines that are for allergies, we will see a drying impact. It's cumulative. And as we live longer and our diets are markedly changing as well, it has a contributory impact, in my opinion. But if a person can keep equilibrium to the microflora of the mouth and keep the mouth clean, even though it's, the microflora and what we call today this environment of good health for bacteria, good bacteria, bad bacteria. 10 years ago, we didn't even use that term. But today, it capitalizes really on what happens in the whole digestive tract. We used to call it oral ecology, and that never caught on. So when we started to talk to patients and say, you really need to clean your teeth, and this is the reason you need to clean your teeth, because if you don't, you're going to find yourself in a dilemma. The dilemma is going to be that you're going to get sensitivity in teeth. You're going to potentially have cavities. You could potentially lose the tooth. You could get bone infection from it. You could have a much reduced quality of life because of the pain that's associated with it. And so, again, majority of patients actually do a very good job. Most of us individually can do a good job. It is when you find yourself getting into the challenge of that you're taking so many medicines, you're doing so many procedures, and having to yet again brush those teeth before you go to bed at night. That can actually be sometimes the one component that gets put to the side, and I think that has a major impact. Dr. Aponte?
Yes, I tend to tell my patients that I have found them a new hobby, and that is to take care of their teeth. Unfortunately. But like Dr. Chambers said, I think for the majority of the patients, they do well, They just, have to work at it, but they do well.
Saliva and artificial salivas can really be beneficial, in my opinion. I think that I believe that there are so many artificial salivas that are out there that we can use today. Thank you. That we really do see its role and its benefit. We really like to see the actual artificial salivas that have no sugar in it. And there's probably 4 to 5 that I really do like and have been part of our patient care for quite a few years. One of them is called Salivart. Salivart is a fantastic wetting agent that can help individuals with the active ingredient called ace mannan, which is an extract of aloe vera. It is so good. It's so good for the mouth, and they've actually made it even into a drink for some. And I find it on the wetting agent side to actually be quite good. The other is a product that is at the Whole Foods market through Tom's of Maine, and it is called Oasis. And Oasis is a product that's highly established, has a little calcium in it. It has enough of a wetting agent to stimulate overall salivary function. Biotene and the Lac Lead Company is the oldest on the market. I've never found much except for the Oral Balance salve that you can put in your pocket and you can put it on the tip of your tongue at various times during the day or before a meeting or before you're about to meet someone. And it can wet the mouth probably for an hour. And so for a short fix, I feel that the Oral Balance is a very good substitute. However, it's not long lasting and it can be somewhat of a nuisance. if you have to keep using it 20 plus times a day. There are a great number of others that we list on our website that one can consider and potentially purchase off of Amazon. Any comments?
There's another one that's called lubricity, and that one is a little bit newer. I think it's been out in the market maybe a couple of years, and the patients really like that. And you can buy it online. Lubricity.
Great.
Yeah.
Great.
Mhm.
So wetting agents, that's one thing that we find to be of benefit. So even though it was a comment and kind of leaning towards a question, what you shared with us a moment ago, I find my passion is how we can enhance a person's life that has had both the 131 and also the external beam treatment to the salivary glands. You definitely have had a drying impact, no doubt about it. Yeah. And taste also, I'm sure has been, yeah, I'm sure. No, I'm so sure of it. So taste acuity going hand in hand with also our, the xerostomia, the salivary dysfunction. Okay, Timothy, what's our Q&A?
We've got a few questions in the Q&A so far. We're up to 7 at this point, so I'll start reading through the first one. It comes in and it says, I had external beam radiation treatment at MD Anderson 12 years ago to rid my neck of thyroid cancer. Since then, I've had gastroesophageal reflux disease and intestinal gas and other digestive discomforts. Is this related to my treatment? And do you have any suggestions for treating?
I think it is related to the treatment, undoubtedly, but it is the sequelae of having a major shift in salivary function and aerodigestive tract function for mucus production that has substantially reduced. And up to the time the treatment was happening, probably the reflux wasn't present. But when one gets to a stage where they lose about 50 to let's say 55% of their salivary function, you start to see a pH change and you start to see that there becomes a substantial alteration in what we find even in our GI probes, that the pH can markedly be influenced because of the damage, and you then start to see the reflux disease starting to show. So a considerable number of our patients, even during the course of therapy, will actually get a anti-reflux treatments or proton pump inhibitors as we actually go through the course of radiation. So I think that even years after your treatment, having proton pump inhibitors being involved or other reflux medicines to be considered. Usually there are so many that our family practitioners have to choose from. I think that's something that's quite good and balancing for the person. I think also increasing the liquid intake, and particular liquids that are going to be more, or let's call it less acidic, can be very beneficial, more alkaline type of products. So very good question. We see it in our practice as well, and we try to be as proactive as we can. Dr. Aponte?
Yes, when you were talking, it came to my mind that, it may be beneficial to do oral rinses with baking soda and water, and that to alkalinize the oral environment. And then from there, whatever goes down, then it would come, to kind of help us change the pH, let's say. And so I do feel like that's going to be important for you.
Thank you. Our next question is, what's the best way to prevent complications? And I'm assuming they mean oral complications from radioactive iodine treatment.
Yes. So I would say that the most important would be that initial evaluation with the oral oncology team, wherever you may be. And I think that would like set the stage, because in that appointment, depending on what is found, then action will take place. And then, you will have recommendations based upon what was found in the examination. And so I feel like, that will set the pace for what's coming next. And so I think that's very important.
Yeah, and I think probably in rural America, it's complicated, isn't it? Because many practices don't have an MD Anderson and don't have the size of our practice.
Sure.
And so in rural America, how do you handle complications or even being proactive so that they will lessen or not exist at all? I think being proactive and learning as much as you possibly can about nutrition, about mouth care, oral hygiene, skin care, I think is very important. And I think that your general dentists and also your family practitioners can also play a part in that. Your endocrinologists are so awesome, usually to get you to those that really can be of benefit, like nurse educators that are also individuals that are very informed on the mouth, the body, nutrition, care, generally speaking. So it's a very good question. Many times it takes us to be proactive when you're in some of the smaller centers of the United States.
Thank you. And that, I think, answers our next question, which is with all the long-term complications from REI, where do people go who are not near MD Anderson, essentially, is the next question. So for supportive care.
We know
So,
that
thank
too.
you.
Many times we, because of the fact that we have a great number of educational programs at MD Anderson, we try our very best to get our fellows, our trainees out to rural America so that we can change practice and change the experience of our patients in rural settings. And so we realize that. And so many times we hope that we can give prescription that can be duplicated in rural America. So I think that that's a very awesome question. Ruth, do you have anything to add to that?
So something that comes to mind, may be the utilization of maybe if you are nearby, like a major city of any kind, you can go to the dental schools, because they always have like special clinics for patients with different diseases, like let's call it like a specialty clinic, let's say, or they have hospital dentistry. And so I think that those two avenues come to mind, when we're talking about this. So don't hesitate to maybe look to see if in the vicinity of your area there's a dental school nearby, because I do feel that's a good asset.
That is an excellent recommendation because there's probably two to three in every state.
Mhm.
How marvelous. Great idea.
Yeah.
Thank you. Our next question is, I have had a lifetime total of 350 plus millicuries of RAI. About 20 years later, I had a molar fracture out of the blue. My dentist was baffled. I had no idea this could be related to RAI. Should I be concerned about other teeth fracturing? And is there anything I can do to protect them?
Yeah, that's a tremendous question. And Dr. Aponte and I probably are thinking almost immediately to a treatment that we have been doing for over 75 years at our institution, and that is a fluoride approach. We've moved our fluoride therapy from stannous fluoride for the majority of our patients to sodium fluorides. And there are a considerable number of other agents that have calcium and phosphate that Dr. Aponte will speak to as well. But it is definitely a need that even if you're years outside of your treatment, that can remineralize your teeth, enhance the gum health, enhance the underlying bone, and reduce harmful bacteria. So the sodium fluorides are so good and so safe, and safer than even that which goes into our public water systems, in my opinion. And so I really feel very strongly about sodium fluoride and or a calcium phosphate treatment.
Yes.
Ruth?
And we discussed a little bit about this in our other session, where Dr. Chambers brought up the MI paste. The MI paste plus is fabulous because it's presented kind of like, I call that one the smart fluoride. And the reason being is because when the pH of the mouth drops, then the little bubbles where the fluoride is encased, they burst. And those are mainly located in the crevicular fluid, like between the tooth and the gum. And that's where it kind of sits. And when the pH drops, it just bursts, and then you get what you need. But the only thing is that if you are lactose intolerant, then you may have a little bit of gas. So I think because of that, then Colgate came up with the Prevident 5000 Plus, which has the same ingredients without the milk, the casein. And so I think, that's where it comes in hand to know these products. Just in case you are exposed to either or, then, now what drives one and what is the other one like. So,
Excellent. So excellent.
yeah.
you. Our next question. I had 155 millicuries of RAI in 2009, 3 surgeries, last one in 2013, metastatic papillary thyroid cancer. This person has pain in the salivary glands after RAI. They've had dry mouth since and no real problems until about 2 years ago when they lost 2 teeth due to caries and about to lose 2 more and 1 tooth with bone loss. So this person is saying, I do excellent hygiene, use prescription toothpaste, biotin, xylomelts, water constantly, and a water pick. Now lichen planus at times too. The dentist suggests a laser treatment of the bone loss tooth. Would that help that tooth? And do you guys have any suggestions or ideas on why this is happening now years later?
Well, you start to get a fibrosis in the salivary glands, which is scarring, that happens when you have had the higher millicurie dosages. And you start to see this scarring, and the salivary function is naturally going to be challenged in quality. So the first thing that came to mind as you were reading the question, and it's a great question, is how can we consider enhancing the quality of your saliva? When your salivary function starts to deteriorate and you start to put out less saliva, the quality typically is also being markedly affected. So saliva is a natural protectant of our mouths. It helps to keep equilibrium for bacteria, fungus, and viral shedding. What I was thinking on my mind when you were asking that question was a cholinergic agonist, which is a stimulant to be given systemically. In your case, I feel could be very beneficial. These are products that are FDA approved on the market. One is called pilocarpine. The other one is cevimeline. Their trade names are Salogen and Evozac. Those could really be beneficial, in my opinion, to give you a better overall equilibrium for bacterial protections. And I think that could really be something to give you an added bonus. The other about laser to the bone, when an individual has substantial salivary dysfunction, and until they can get some type of a therapy for competency, I am not typically in favor of laser onto a bone that is living in a very dry environment. Typically, that can also promote some wounds, and many times our patients are going to heighten on the sensitivity around the teeth. If we're trying to encourage greater soft tissue coverage and or health generally over various parts of the mouth, with laser treatments, I think it does have its role. I'm not convinced, however, that is not going to worsen your state of affairs. Dr. Aponte?
Along with the thought of perhaps a cholinergic agonist, maybe perhaps you can also have like a nuclear test before undergoing that to see what is the real output of the salivary glands that are functioning. And so with that said, if there is some activity, then I would surely, go with the with a systemic treatment. Otherwise, I feel that maybe you will not get too much, benefit from it, if there's no function.
You know, one of the nuclear tests that we typically will schedule is what's called scintigraphy. And that can really give information as to the production of saliva from major salivary glands. Again, a very good question and a very complex approach.
Absolutely.
Thank you. And just a heads up, we have about 20 minutes left in the session. Our next question, I'm going to rephrase slightly here, but the person is wondering when, at what level of radioactive iodine treatment do conditions start to be seen? And because I would assume the lower the level of RAI that's given, the less likely you are to have a complication from it. But I think they're asking what is that kind of threshold to say, when do you start to see more and more complications arise?
Yeah, some people can actually see it within 48 hours, where you start to see frothiness in the saliva, your taste acuity starts to change. You feel like you have a real acidic mouth because the mouth is drying already. And usually, acutely, it can be very short for some. Average, I would say, is probably 15 to 30 days after your introduction of the iodine. And I feel that it can worsen according to the patient's periodontal health. Dr. Aponte?
Yes.
And I think they're asking also if there's a millicurie level, like a dosage
Yeah, we typically
that
see
you
most
typically see.
damage at 150 and higher. Mostly
Right.
the damages that are at 150 and higher, typically we find more of the acute complications that can actually move to a chronic problem.
Yes, like in percentages, about 20% is what, the papers talk about. Yes.
Thank you.
It's a great
Our
question.
next question. Oh, sorry, Dr. Chambers.
No, that was just a great question. Thank you so much.
Thank you. The next question is, the person has had 2 high doses of radioactive iodine over 200 millicuries each that did not work in 2008 and 2009. Lots of dental issues, soft teeth, and clenching. This person is 74 years old and diagnosed in 2008. She would like to get an evaluation, and she wants to know how to contact you. She's in California.
Yeah, that's tremendous. We can be easily contacted, Dr. Aponte and I both, and you can reach out to us through either the MD Anderson's internet, which is www.mdanderson.org, or our email address is I'll give mine and then Dr. Aponte will give hers, is mchamber. My last name is Chambers, but I have no S on it. So mchambers at mdanderson.org. Anderson spelled with an O. And Dr. Aponte, what is your email?
Mine is raponte@mdanderson.org.
Perfect. And please feel free, for those of you that did not have a question, but or were a little hesitant to ask, please send us a question. We have great staffs that can actually help to triage some of those emails to us, and we will get a response back to you.
Thank you. And I did put those email addresses out to everyone that is attending virtually through the chat. So I hope everyone got those. Our next question is, the person will be having radioactive iodine next month, and they're wondering if there's anything they can do to prevent salivary issues.
Yeah, it's very intriguing because research has gone both ways. We have moved in the direction of substantial stimulation, where we have placed a number of stimulants in order to secrete more. And it has been compared to when we literally shut the glands down with atropine. And it is so mixed emotions about both outcomes. We find that overstimulation probably is going to lead to some more problems. You get more blood engorgement when you try to overstimulate. And then when you understimulate and or create a profound dry mouth during the days, it also enhances a very bad experience during that window of time. So I like to stay natural. I like the idea that you use a product like Salivart, or that you are placing into the mouth something that's gentle as a rinse, just to help with a gentle increase in salivary function and not a substantial overstimulation. Salivart would be one way to do that. Oasis is another, and you can do it in a minor amount as a rinse that you can do a few times a day. And I think that that can be very beneficial. Keeping the mouth clean and trying to reduce what is a bad approach to mouth care, such as going to bed with heavy plaque and food debris on your mouth, and just eating a meal, eating a Twinkie, and then going directly to bed. That sugar and all that fat that is within that product can really be challenging. And it can also enhance substantially the reflux component to all of this as well. Dr. Aponte?
So also, if you have had already your dental evaluation, that would be a good starting point. But if you haven't, but you are an avid dental seeker and you do visit your dentist, on a periodic, schedule, I think, you're probably doing the right thing. And so, just keep that in mind to then after your therapy, resume and continue doing the visits with your dentist so you can have dental cleanings and be on the preventive side of things. That's what I would emphasize.
Yeah, as an additional thought to that also is that I also do not believe that when you have been introduced to a therapy after being diagnosed with cancer, starting something new that is an herbal supplement or a antioxidant or an approach that is not one that is being prescribed to you, in my opinion, can also result into some adversity, potential adversity. So this is not a time, in my opinion, at the beginnings of therapy to do something that could be tumor protective and or to markedly change the dynamics of healing. So starting something new that your family and your friends and your neighbor have said, well, this helped Harry, and this helped Aunt Judy, and this helped my mother, it actually helped me, is something that you should place some caution towards when you are starting your therapy.
Thank you. Our next question is actually, I'm going to combine a couple questions here because it's comments about the Salivart. One person is asking if it's over the counter or prescription, and the other person is saying that they think it has been removed from the US market.
Yeah, it could very well be. We may have bought the last of the stock, maybe. It is a over-the-counter product. Today, I use Oasis more than I do any of the actual products, plus Oral Balance salve. So if we can't get that, then what I traditionally do is most of our prescriptions, we say we want to have a artificial salivary substitute, is how we traditionally will do our prescriptions. And then we specifically ask for the agent. And many times that's kind of a map. Let's say you go to Walgreens or you go to Whole Foods or you go to Walmart as your pharmacy, that tends to not necessarily be used for an actual conventional prescription, but more of a focus that the pharmacist can actually pick up for you. So Oral Balance and also the Oasis, I know, is on the market. And so those are two products. And of course, the one that Dr. Aponte presented as well.
Lubricity, yeah.
We like some of the over-the-counter products. Makes it
Yes.
much simpler.
Of course.
Okay. Our next question has a personal story of someone who has Sjogren's disease and had a back molar break after REI in 2020. after they've had problems trying to find a oral surgeon who would take them on, and they finally did at Houston Methodist, and it was removed earlier this year. So the question is, with the dental care disparities common for individuals with disabilities, what are your best recommendations to maximize oral health?
Yeah, I was going to share that with external beam radiation treatment, when various areas of the oral cavity are well within that volume of tissue that's been radiated, it can be a bit of a gamble of whether an individual is actually going to heal from surgery or not. Sometimes we actually incorporate hyperbaric oxygen treatment or other agents to actually increase circulation to the upper jaw or the lower in order to have a better outcome for surgical intervention. If a crown fractured, obviously it also appears that there is a contamination challenge as well with higher concentration of bacteria. And so I'm really glad that they found one of our partners at Methodist to take on their case. And there's some fabulous oral surgeons there. And I would say that that again, as you have heard us kind of repeatedly, and we speak to it almost across the board for many of our patients, whether it's stem cell transplant or head and neck or a neuro. If there is a radiation component and it's going to be anywhere near the salivary glands, the salivary tissues, we know that there's going to be irreversible damage to those glands. And although that an individual may say that they feel like they have competency in their saliva, they usually have a qualitative challenge. So the quality of the actual saliva can be markedly, actually overly challenged. So I'm glad that individual has found peace with getting a dentist, an oral surgeon that would treat their mouths. I do think that it's important to let's call it starting anew with a product that can help with contamination of the mouth, which is sodium fluorides. And to get your dentist to prescribe that. The product that we talked about earlier today is called Prevident 5000 Plus, and that is by prescription. If we can find that for our patients, it can really enhance the oral health and outcome of the oral health. Dr. Aponte?
Yes, I concur. And so if radiation has played a role in your care or in the care, along with the radioactive iodine, then perhaps maybe an extraction may not be the solution to the problem. You may have to have a root canal and cut the tooth to the gum line. And that, we haven't discussed that today, but we do that, a good bit. And that is just to help preserve, the integrity of the bone. And so that is another, treatment that we recommend.
Thank you. Our next question is from a 19-year papillary thyroid cancer survivor who has had 2 rounds of 200 millicurie dose of radioactive iodine. They only have 1 left functioning major salivary gland, and they wanted to comment on their xerostomia is so bad at night that they have used a Vutia device for oral hydration, and recently switched to the Salvate device. And they comment that these have been lifesavers essentially for this person. So any thoughts on that?
No, but there's so many magnificent new approaches to increasing salivary function. I think that that's fabulous, that's worked for that person. And I think that we're at an age now that stimulants can be so amazingly beneficial. One area that I've spent a great deal of energy and also research is in acupuncture. And over the last 20 plus years, we've been using acupuncture in our place of wellness and referring our patients to acupuncturists throughout the United States, actually throughout the world. And we use what we call the 13 points of Nipchow. And this is a highly validated approach with a study, multiple studies that we've published that show some substantial increase in function when the acupuncture is done accurately. And it takes an amount of time for stimulation to actually take place. But as a doubting Thomas, I was pretty surprised over 20 years ago when I knew that that was more hocus pocus. And I really said, I don't know if I want to participate in this study or not. And then I did. And boy, did I prove myself wrong. And now I use it very heavily in our practice. And we just completed one of the largest acupuncture trials between two comprehensive cancer centers, between Fudan University and MD Anderson Cancer Center. And it was over 500 patients that we followed for several years. And the 13 points of NIPCHOW works.
So, along with this, the therapy should be twice a week for at least 4 consecutive weeks, and that is what shows the difference. And so it's the repetition and the consecutiveness of the approach. What makes the difference. So,
Right, in addition to having a master acupuncturist
of course.
and being in a very reputable and board certified environment.
Sure.
Right.
Thank you. Our next question is about after having radioactive iodine, a person developed burning tongue and mouth syndrome that it appears about once per month and lasts about a week at a time. Have you seen this in others post radioactive iodine treatment or scans? Burning tongue or mouth syndrome.
Absolutely. And I'm
Yeah.
sure Dr. Aponte has a few thoughts there.
Yes, I do feel like it is hand in hand with the dry mouth. And yes, so I think the key here would be to help mitigate the dry mouth, and then maybe perhaps eliminate a little bit of that part, and then the relief from the burning mouth can, help. Yeah.
Yeah, it's so interesting to see saliva. It requires a stimulus. We all have to have stimulus in order to get secretions. And when there's an alteration in minor salivary gland tissue or major salivary gland tissue, many of us can move into a burning mouth or burning parts of the tongue. And sometimes that is electrolyte balancing. Some of that could be also other, let's call it organic elements to our saliva that gets highly depleted and becomes imbalanced, contributing to the burning mouth. But higher centers in the brain, that is our salivary centers, if there is any disturbance to those centers, through chemotherapy, immunotreatments, whole brain radiation, we see that same problem that patients can also find themselves dry and they also find themselves with some burning conditions. First thing that we would want to determine is if there is a fungal challenge on that individual, and to make sure that we are looking at what is the actual quality of the saliva in general. And we know in our practice that burning mouth can be associated with fungal contamination called candidiasis. It can be from other organisms. It can also be from viral shedding. And so, again, another good way of having an approach for that individual is first doing some homework and determining from discovery what's actually happening in the mouth.
Mouth, yeah. If there's a fungal component, yes, I totally agree. And we haven't discussed anything about the role of xylitol in prevention of carious lesions, and then also as a wetting agent. And so there's some discussion about, if the xylitol is to a certain amount, then it can cause diarrhea, right? So that is maybe one of the things that, kind of deters us from prescribing like a rinse with xylitol. But I do feel like, there's a lot of products out there like gums with xylitol. There's candy with xylitol, and those are perfectly nice for like help like to moisturize the mouth, like the gums particularly. And so I do feel like it plays a good role.
And we prefer that, don't we? Instead of the pure sugar,
Mm.
like some of the, many of us as we grew up with Wrigley's chewing gum,
No.
we tend to now go to Trident and so many of the other products that have the xylitol in it.
Yeah.
Yeah.
And I know in Whole Foods, they have like a little section where you have like different kinds of gum, and it's all xylitol related, so just in case you're curious, go to Whole Foods and, find some of that.
Nice.
Yeah.
And I'm sorry to say that we have about run out of time, so it is up to you if you would like to continue to answer maybe a few more questions here. We've got some good ones, but we are officially out of time otherwise.
Yeah, I think what we would like to do is just to do kind of a summation of saying that one thing that's been more or less a common theme, whether we would have shown a PowerPoint presentation today or not, one of the things that is really a common theme for us in oral oncology is the fact that we really believe so strongly in what oral health can do for the general well-being of a patient. And whether you have had 131 therapy or whether or not you've had external beam treatment and surgery and or other chemotherapy agents that have been added or targeted agents, we know the importance of keeping yourself as healthy as we possibly can manage and support you. And one of the things that many of us fall short in is after we get cured, we still live for many years thereafter with the side effects of our treatments. And so many of those conditions can actually worsen over time. As we get older, as I shared earlier, we start to take new medicines and we start to take new medicines along with other procedures. And many of those can also enhance the overall impact of more drying, more challenge with regards to swallowing. And so there is this cascade event that happens many times with the type of approaches that we give to our patients. And then if you're seeing 3 or 4 or 5 physicians, each one of us may be giving you a little different medicine, and you're taking a lot of agents, and that's another problem in oncology, generally speaking. So I wanted to say that it's important that you have a dentist or a dental hygienist seeing you. I think it's so important for oral care. I feel that if there's an oral oncologist that's near you, it's a great way to get acquainted with ways to improve your oral health if you've had cancer treatment. I feel that also that if there's dental schools, as Dr. Aponte said earlier, I think it's a great adjunct as well because there's so many oral medicine programs that would have specialists to see cancer patients. We at MD Anderson are very proud of our supportive care service. We have been part of MD Anderson for 83 years. And so we have this rich heritage, and we are so well coordinated with the 7 of us that are on staff. And please consider to reach out to us. If you would like to have an appointment with our service, please reach out with those email addresses. We can help you to facilitate an appointment. And if not, please give us, if you desire more information and you want more dialogue with our teams, please do that through that email. Dr. Aponte?
Yes. And thank you for having us today. This is a great pleasure to be here and to be able to share, and, get to know you. So thank you. Thank you for having us.
Well, thank you to both of you for speaking today and sharing your time and your expertise. I'll remind all of our attendees that the physicians, the dentists, the specialists, everyone who comes to this ThyCa conference is donating their time and their talents to be here to speak to us. So it is with a great deal of appreciation that I say thank you to Dr. Ruth and Dr. Chambers for coming today and sharing of your time and your expertise with us.